So someone wanted to know about square wave jerks, and a square wave jerk is a jerk movement because it's a saccade. It's an involuntary horizontal saccade that moves the eye off of fixation, and so it looks like this, and it's bilateral and conjugate, horizontal, and the patients don't even notice they have it because they have a saccadic suppression. So when they make an ENG recording, they can see that there's a saccade to the target, and then it just goes back down to the baseline. So in the eye, it looks like this. And so these square wave jerks are very non-specific and can be the result of any lesion in the supratentorial or the infratentorial region, brainstem, basal ganglia, cerebellum. So it's not very localizing. It's not specific. And in elderly patients, it often happens idiopathically for no reason. However, you should be worried about the neurodegenerative disorders and in particular progressive supranuclear palsy, although the differentiating feature of PSP is downgaze palsy that's supranuclear, not these square wave jerks. So we would not use square wave jerks to make the diagnosis of PSP. In young people, it's way more likely to be something pathologic, but in old people, it's not very helpful. So it's a saccadic intrusion. It's involuntary. It's horizontal, bilateral, conjugate. It's like a back-to-back saccade. And if it's multiple recurrent back-to-back saccades, that's not a square wave jerk anymore. That thing is called ocular flutter. And if it's multidirectional rather than horizontal, that's called opsoclonus. So opsoclonus, ocular flutter, these are pathologic and need workup. Square wave jerk, very non-specific, but if you find a lesion, usually it's neurodegenerative, but it's not very localizing.